Now, Charlie, back to you.
All right, thanks very much, Tony. We have talked a lot about gastric bypass surgery on this broadcast, and there are benefits to it, to be sure, but we have a story now for you about a California woman who is fighting for her life after undergoing this surgery. Something has gone terribly wrong with 52-year-old Lauren Root. She has lost more than 200 pounds, and she can't stop losing weight. She now weighs just 87 pounds. ABC News medical editor Dr. Tim Johnson tells us her story.
Lauren's weight wasn't a problem growing up in Los Angeles. She blossomed into a beautiful young woman and bride. But after a divorce and raising a son on her own, she packed on the pounds and lost her job as a legal secretary.
I would use food as a comfort.
Her parents were worried.
She'd stay in the house and just watch TV and eat candy.
This was Lauren at 330 pounds before she underwent gastric bypass surgery a few years ago to lose weight quickly. Lauren thought bypass surgery was a quick fix, impressed by the celebrities who had had it done. So apparently are many others. 150,000 patients are expected to undergo gastric bypass surgery this year. Typically, a tiny part of the stomach is sectioned off and attached to the lower end of the small intestine to limit the absorption of food. Lauren had an unusual variation of this surgery and afterward couldn't figure out why she was losing so much weight so fast.
I lost 200 pounds in the first year. I was very sick. I had all kinds of internal problems, and I've been in the hospital over 30 times in the last 2.5 years.
Lauren and her doctors don't know exactly what's wrong with her body.
Just all I wanted to do is just be a normal person. That's all.
She now regrets having the surgery without asking enough questions.
Didn't do any research or any investigation or anything like a dummy.
When Lauren dropped too much weight after the operation, she dropped her bypass surgeon and is now being nourished intravenously at UCLA Medical Center.
She's dying of a slow starvation. Hopefully we can get her health back.
Surgeons hope that when and if Lauren increases her weight to their goal of 120, they can operate again to change the bypass surgery. In the meantime, her parents are very worried.
We'd like to see a smile on her face again.
It's rough on the kid. Will always be our kid.
People need to know there's a really bad side to this procedure.
And we are joined now by ABC News medical editor Dr. Tim Johnson. Tim, you mentioned the figure 150,000 of these surgeries expected this year, or last year.
Oh, expected this year, yeah, up from last year considerably.
And just a year ago, there were 120,000.
Right.
So my question, are doctors going to this, prescribing this surgery too often?
That's part of the problem. There are some doctors out there, I think, unscrupulously promoting the surgery as an easy answer. Having said that, however, for people who have really tried with diet and exercise and even medicines and have failed, this is an option in which the benefits for such people who have truly morbid obesity will outweigh the risks.
But that's the underline. You say it is only for the morbidly obese.
Absolutely. This should be a treatment of last resort, not a thought of as a treatment of easy first resort.
But how common are the Lauren Roots?
Well, the death rate, for example, is well under 1% as far best we can tell. That's acceptable for a very major kind of operation. The nutritional complications, deficiencies, are very common. 30% of patients have nutritional problems because they're not absorbing enough food, vitamins and minerals, and that can lead to anemia, osteoporosis, for example. 10 to 20% of people will have further surgical complications, including the fact that the wound won't heal and it'll have to be repaired, or the internal stapling that typically goes on will break apart. If they have it done laparoscopically instead of through an open incision, some of those complications are less. So people have a lot of problems after this operation, but if they know what they're getting into, if they do it sensibly, and if they are monitored carefully, and most importantly, I think, given both emotional and nutritional counseling, they can survive it and they can do quite well. But they shouldn't rush into it as she did, thinking this is going to be easy and there's going to be no problems.
Not a neat way to lose weight. only for the morbidly obese.
That's the bottom line.
All right, Tim Johnson, as always, thanks very much. Gastric bypass surgery. Robin?
And Charlie, as you know, today is the third